video, we're going to look at how to safely draw up medications that come in glass ampules without cutting yourself and without getting glass in the syringe and giving it to your patient. This is one of the most common problems with these glass ampules. So of course, the first step, as with any medication administration, is to calculate the required volume of medication needed. So look at the vial and do your dosage calculation. In this case, let's say that we have calculated that we need 2 milliliters. So grab your 3 ml syringe, and this time, instead of a blunt tip needle like you would for a vial, you need to attach a filter needle. This is how we're going to prevent getting glass into the syringe and then into the patient. Once you've attached your filter needle, you want to hold the ampule in your non-dominant hand and make sure that you get all the bubbles out of the top of the ampule. You can flick it or you can tap it on the table gently. Now you want to look at the top of the ampule and see if there's a little dot on it. If so, that is where you want to plan to put your thumb. So you're going to wrap a piece of gauze around the top of the ampule, or you can even put the top of the ampule into an alcohol pad package. Put your dominant thumb over the dot and line up your non-dominant thumb with it on the base. And then using your thumbs, you want to break the ampule open away from you. This is the part where I have seen people cut themselves, so be very careful here. Once you have snapped the top of the ampule, you want to carefully take the glass part that has come off and set it aside or directly into the sharps container if you have one available. Now you can grab your syringe with your filter needle, uncap it, and you're going to insert it into the ampule and withdraw the correct amount of liquid from the ampule. You may need to tilt the ampule to get the liquid. If your needle's not long enough to go to the bottom, you can invert it quickly and withdraw the fluid that way. Once you've got the amount that you need, you can safely recap your needle with the scoop technique. And then you'll want to remove the needle and dispose of it in the sharps container. As always, if you are not administering this drug right away, you must label the syringe with the drug, the dose, and the date, time, and initial. Make sure that you're following appropriate administration based on the ordered route, and of course, always follow your 5 rights. Now go out and be your best selves today, guys. And as always, happy nursing.